Welcome to the Health Matters program produced by the Ministry of Health. I'm Alicia Martin, your host for today. Today we'll be talking about cancer awareness, care, and prevention. Joining me on the program is Dr. Shanique Greaves, the Coordinator of Cancer Services here at the Ministry of Health Chronic Disease Unit. Here at the Ministry of Health. Welcome to the program, Dr. Greaves.
Thank you for having me.
So as we observe World Cancer Day 2025, we would like to talk a little bit about some of the cancers in Guyana that are most common. Could you tell us about that?
Okay, thank you for having me. As it pertains to the most prevalent cancers in Guyana, they are breast cancer, cervical cancer, prostate cancer, as well as colon and rectal cancers. Of course, we do have focus on childhood cancers, which are also very much prevalent. They come in the form of leukemias or brain cancers or other types of tumors like the Wilms tumors or neuroblastomas. But they're all very much on the they have been increasing over the past few years. That for us that poses as a serious health problem.
Thank you so much, Doc, for explaining that. What does the general public need to know about cancers in general? And I know when people hear the term cancer, they usually get scared. But what is a cancer and how is it developed?
When it comes to cancer, it really is more like an activation of the growth of these abnormal cells within your body, and it could be for various reasons. There's just it's like a switch that just goes off, and these cells start to activate. They start to multiply, and with time, they no longer they try to change up the structure of your normal DNA cells. Over time, as these cells start to multiply and divide, they kind of take away from the normal cells, the regular program of that cell functioning, and then they start to take over the body. And it's around that time maybe we start to show some form of sign or symptoms where it might be something very mild, or it might be a little bit more serious in terms of the symptoms, and of course depending on the location.
Yes, definitely. I know that the Ministry of Health has over time been pushing really prevention and early screening. Could you talk about the importance of those health checks? I know many people usually wait until there's a very bad health issue before they visit their local health centers or even see a doctor. So could you tell us about the importance of getting your regular health checks just to ensure that you're in good health?
You know, I always like to say prevention is always better than a cure.
Yes.
Which means that whereas we can be able to avoid a disease from happening or any sort of disaster, we should get in front of the situation in doing so. Unfortunately, it's not a very much practiced culture here we have in Guyana. We always, as you said, we tend to wait for that last moment when it really affects us, when we can't do our job at home or at work. And then we say, I need to go see the doctor. And because of that, we have been having increasing cases of persons coming in, and when they get their diagnosis, sometimes it's just too late. So it is important that we get our routine screening done. As much as we might feel, oh, I'm healthy, I don't have anything, I don't have any signs or symptoms, it doesn't mean that there's nothing going on. We still need to do our routine screening in order to know for sure whether or not it's something that we might catch in the very early stage, which gives us a lot higher survival rate, or if it will be in the very late stage, which of course it will decrease with that staging.
So definitely early screening is important. Could you tell us a little bit about those strategies that the Ministry of Health would have implemented to better raise awareness across the regions?
Yes, we do have an array of strategies as it pertains to the cancers that I would have mentioned earlier. And this is an ongoing process for us. Whereas we would have launched an action plan last year as it pertains to the cervical cancer elimination program. And that is something that we have implemented, and it is ongoing, and we will also, of course, be reintegrating back into society for this year. We do have other action plans that would have been carried out, which would have been under the prostate cancer program, as well as we are currently seeking to do our strategies for breast cancer. And eventually we'll take a look into colorectal cancers as well as childhood cancers. It is a lot to process process. So it is an ongoing process, but we are committed to ensuring that the people here in Guyana are able to access quality care and are able to get their screening done as they should.
Definitely. What can the public do? Because I know as much as the ministry has a role to play, the public, the people out there, they too have a role to play. So what can they do with regards to prevention?
As pertains to prevention, I would like to say not just the public only, but on our end, it's awareness. It's not just about, okay, I heard something going on, let me go get tested. You want to be informed of what's going on. You want to know, okay, this is the disease that we're talking about. This is why I need to get treated, or I need to do my routine screening. These are some of the risk factors that might put me at a higher risk of contracting this disease. And these are some of the prevention methods that I can also put in place to avoid myself from getting there. So the only way you can do that, we need to be informed. And it's important. I don't think we can stress enough the importance of being aware when it comes to our health, and be a little bit more health conscious, and not just listen to the 2 things our neighbors might tell us on the way, but we need to also do our own personal reading. The different areas where we do have pamphlets and information is available. We have an internet search that it's so vast. We can use it for to receive so much information. And it's important that we do need to start to make better use of it, as well as here at Ministry of Health, we will be issuing different bulletins as it pertains to these different cancers and how we too as a population can stay informed. So we want to be able to stay informed, and of course, always stay on the lookout as it pertains to whatever screening programs that will be initiated by the government. As stated before, we did have our HPV voucher screening that started last year, and that is something that we will be reintegrating back into this year. And throughout the year, we also have for our breast cancer program that we will be initiating different services. So we want you guys to just, always keep an ear out and wait for us as to we give you that information so that you can be able to access that service.
Stay updated indeed.
Stay updated.
Thank you so much, Dr. Greaves. We're going to go into a short break and be right back with more on cancer awareness, care, and prevention.
The thought of developing cervical cancer may seem scary, but the good news is that it is preventable and treatable. The key is vaccination and being screened early. Cervical cancer is the second most common cancer in women in Guyana. It is caused by the human papillomavirus, commonly known as HPV. Almost all sexually active people will be infected with HPV at some point in their lives. Therefore, it is important that women aged 21 years or older get screened for cervical cancer. Prioritizing regular pap smears, VIA screenings, or getting an HPV test done is crucial. These tests will aid in detecting precancerous lesions, making it easy to catch cancer in its early stages. These screenings are quick, easy, and free of cost. They are available at various public health facilities in your region. Remember to spread the word and encourage your female friends, mothers, sisters, and daughters to prioritize their health. Early detection is key to successful treatment and a long, healthy life. Together, we can prevent cervical cancer. A message from the Ministry of Health.
Welcome to our website. We're here to provide you with reliable health information, services, and updates. At the Ministry of Health, our mission is to protect the health of every citizen in Guyana. We are committed to offering accessible, high-quality healthcare, helping individuals and communities to lead healthier lives. On this platform, you can find a variety of resources to support your health journey. Check out our programs that cover different health needs, from preventative care to managing chronic diseases. Stay updated on our latest initiatives and policies aimed at improving public health across the nation. We'll keep you informed about the important public health updates, including alerts, vaccination campaigns, and community health events that promote awareness and education. Thank you for visiting, and we look forward to your continued connection with us in our shared goal of a healthier future for everyone in Guyana.
Welcome back to the program. For those of you who have just tuned in, today we're talking about cancer awareness, care, and prevention. And joining me today is Dr. Greaves from the Chronic Disease Unit here at the Ministry of Health. Dr. Greaves, what key information should all women be aware of regarding causes, risk factors, and prevention of cervical cancer?
Yes, in terms of key information, I think what we'd want to know are some of the signs and symptoms that you want to look for that will tell us, okay, we need to go and be seen by a healthcare provider. And some of those would be any abnormal bleeding outside of your regular menstruation. If it is that you're having, whether it be spotting or between menstruation, or if you're having abnormal bleeding or menstrual cycle that is prolonged, that's something that you do want to get checked for. Also, if it is persons are having painful sex, or you're having pain after sex, if you have any bleeding during or after sex, also that is usually cause for concern. In terms of vaginal discharge, any abnormal vaginal discharge, that usually is something that's recurrent, like you've been taking medication for and you find that it's still not working. It can be different reasons that it might be cause for it, but if it is that you notice you've been taking treatment and you're still not getting resolved, you also want to go to get checked, because they might want to run some additional testing on you. Other things like lower abdominal pains or back pains. Sometimes you might see a little bit of swelling to the feet or fatigue. Those are very general symptoms that we look for, because as it pertains to cancers in general, in early stages, it's very rare that you find persons with symptoms. It's usually coming down to more the advanced stages that someone would start having symptoms, and that would be a telltale to say, okay, I really need to go get this checked out. Another thing that's very important for women who would have already gone into menopause. Ideally, menopause signifies that you stop seeing your health, or you stop seeing your menstrual cycle. So if you notice that it's been years after your that you've gone into menopause, and then you started noting some bleeding, some bleeds coming from the vagina, that's also a very important cause for concern that you want to go get that checked out.
Okay, what screening methods are available for cervical cancer here in Guyana?
So here in Guyana, we have three different screening methods that we're using. We have the VIA approach, and then we also have the pap smear. The VIA is more of a one-stop shop, whereas you are the visual inspection with acetic acid, whereas acetic acid is more or less the household vinegar that we use. And the screening is done using that solution, and ideally a pink cervix on examination after the acetic acid is placed usually means that it's healthy. However, if you start seeing any whitish lesions or so, it usually tells us it's positive. Now, it doesn't say that it's positive for cancer. It just says it's positive for an abnormal lesion or changes on your cervix that need to be treated immediately. And that's usually like what we call a one-stop shop, because you can go to your healthcare provider, VIA provider, and you get that done and you get your treatment. The pap smear is a little bit more advanced, whereas you take off cells from your cervix, and that's placed on a slide and then sent for the pathologist to read off. So that will take some days or so for you to get back the results, but it's a little bit more advanced or specific, because yes, it's going to tell you that you have abnormal cells in your cervix, but it's going to also give us some more information as to what type of cells, and if it's more in the precancerous region or if it's more suspicious for cancer.
What can women expect whenever they're going to get screened? I know a lot of women are a bit iffy about going and so on. And so we want to ensure that they have all the information that they need and that they're comfortable during that process as well. Tell us about that.
Oh, yes. I think this is one of the biggest fears for women, hence why we don't always, women are a lot more reluctant to get tested. But yes, it is. You're going to have what we call a pelvic examination. You go into the room with your healthcare provider, and ideally, we try to explain to you what the procedure is about, what to expect, and what is the role that you need to play. So you're placed on the gynecological bed, then your legs are placed in a certain position, and from there we have this instrument we call a speculum. The speculum is usually entered into the vaginal canal in order to expand it a bit so that we can have access to your cervix. Once you're able to visualize that cervix, that's where we either do the VIA or pap smear, depending on which of the services is preferred.
Thank you, Dr. Greaves.
So yes, you may have a lot. I wanted to say, many times you might hear a person saying that, oh, it's painful, oh, it's really difficult. I don't like to use the word pain. I like to say discomfort. And the idea is for you to be as relaxed as you possibly can. Because of course, when we feel very tense, it will make the examination a bit more difficult for the healthcare provider as well as for yourself. So it is important to just try your best to relax, go in and stay as calm as we can, or go to your happy place. And it's usually a very quick procedure. Most times under 5 minutes, you can get the test done. So we just need to think about that to try to overcome the fear. And it's always good to get screening, because at the end of the day, you have to see which one outweighs the other. Is it the fear of doing the exam or the fear of not knowing what your results are?
Dr. Greaves, regarding breast cancer, what screening methods are available for that, and what would be your encouragement to women who haven't yet, access those services at our various health centers? In fact, where can women go to get screened for breast cancer?
As it pertains to screening for breast cancer, ideally persons who are at high risk. And when we say high risk, we mean if it is that you would have had a family member, first line, for example, your mom or your sister, who would have been diagnosed with breast cancer, you would also be placed as a high risk. And also, if it is you would have had a previous history of having breast cancer or any type of cancer, we also place at a high risk. Other than that, for women who have not conceived, or they have not breastfed, they have not breastfed, are also placed at a high risk. And then, of course, we look at the age. When it comes to screening, it usually starts off from about age 40. If it is you've had family members like your first line that would have been diagnosed with breast cancer, depending on the age that they were diagnosed, we usually track that back to about 10 years or so before for you to start your screening. So let's say your mother was 45 when she was first diagnosed. By age 35, we expect you to also start screening.
Wow.
So screening methods are usually the mammography, as well as we have ultrasounds available. And ideally with the mammography, it's generally from persons at least age 40 years. And I know that's another very uncomfortable setting that you hear many women would complain about from time to time. In terms of, they feeling a discomfort whenever they have to do the actual screening. We have had different technological advancements, and the screening method is not as before. So as it pertains to the mammography, we do have a lot of misconceptions that, they kind of squeeze and pull down and the breast is slammed in, and all of these different experiences that persons would have gone through. But really and truly, yes, there is some amount of discomfort, but it is a screening technique that has worked, and it is necessary and very much needed, and it's just for a few minutes.
Thank you, Dr. Greaves. We know that childhood cancer will be observed also during this month. It's International Childhood Cancer Day, which is observed in this month of February. With regards to childhood cancers, what are some of the most common cancers that we see here in children?
So cancer is the leading cause of death for children. And a lot of it comes about because of the fact that when it comes to prevention and an early diagnosis, it is something that is very much delayed. And then when we look at certain countries or certain areas that are low to middle income resources that might not have the adequate amount of treatment or the available resources in order to be able to detect these cancers, those are some of the things that tend to cause delayed treatment, and as well as it decreases your survival rate. So it is something that we do need to, that we are currently working assiduously in order to create a strategy to combat that and also to decrease the disease burden.
For these various types of cancers, we want to talk a little bit about quality care, not just from the health facility point, but also from family members and loved ones. For persons who have been diagnosed with cancer, how can their family members better support them and, help them through that process?
Yes, as it pertains to support, when it comes to support from family, it is very much ideal because being diagnosed with a disease that, you hear so much about it, that it kind of gives you, people feel like if it's already like a death sentence. It does tend to play a lot on the mental health, and it doesn't just affect the person that is being diagnosed, but also the family that has to be able to take care of them. So it is important that this is the part where we, as a population, we do need to come together and lend that helping hand, whether it be to another family member,
Yes.
to a neighbor, to a work colleague. And one of the ways we can do that is first staying informed. We need to be informed as to what the situation is, and then something as simple as asking them, how can I help? How can I ease your burden today? And it doesn't have to be any great, big or grand gestures. Something as small as just sitting and having a conversation with them to take their mind off of everything that they're going through, or just sharing a meal with them or taking them for a walk. These simple acts of kindness can go a long way to help.
My name is Ms. Pauline Gofayo. I'm here to speak concerning cervical cancer because I'm a survivor. Well, my life, I had a wonderful life before. I was very active, very independent person. I used to like traveling a lot. I used to like doing craft, a whole lot. That was part of my job, and I used to enjoy it. In the year 2018, I noticed I started to lose weight, and I used to ask myself why. But I was a kind of person who was beyond the stress at times. As time go by, I find one day I started to have spottings. After then, I had a heavy bleeding. That is when I started to get curious and wanted to know what is really happening to me. So I went and I checked with the doctor. And when I went there, they said they suspect that because after my age, going into menopause or premenopause, I shouldn't be having those conditions. Then I got the news broke. Some of my challenges I faced after the diagnosis and treatment caused me some big changes in my life. The way I look, the way I think about myself, the scars from the radiation, fatigue, sleep habits also change, anxiety, step in. I also started worrying a lot. Cancer is a terrible thing, but it did teach me some valuable lessons. I had to change my eating habits, to take better care of my body, to keep cancer away with nutrition. I had my children. Sometimes they couldn't support me financially, but the presence and the encouragement of them was there for me. And well, the Ministry of Health, they normally play a part too. They step in, and I also had outside help, like from the periwinkle, giving hope. Yeah, those were my supports. So my encouragement to you ladies is get tested early. Early detection save lives.
Have you heard about the school health program? This is a partnership between the Ministry of Health, the Ministry of Education, and the Mount Sinai Health System. Through this program, the Health Ministry aims to provide children from nursery to secondary with early health screenings. This program ensures that your child receives a comprehensive health checkup at least once in nursery, primary, and secondary school. This includes a physical examination, eye and ear exam, dental checkups, and growth and development monitoring. Early screening gives the health system an opportunity to provide effective treatment by catching any potential health problems early, ensuring your child starts life on a healthy note. Parents and guardians, with your support and consent, we can help pave the way for healthier children with bright futures. To learn more about the school health program, contact us at 227-4357 or visit our social media platforms. A message from the Ministry of Health.
Dr. Greaves, Tell us about the activity that you guys are hosting this Friday, the health fair. Tell us about that.
Yes, so here at the Ministry of Health, we are excited and eager to have our very first health fair for this year, and it's going to be in observance of World Cancer Day. We will be having different services available, consultations, and different testing available. So we do urge the public to come down and to check us out, to be able to take advantage of the services that we will be having available.
And this will be held?
So it will be held at the Square of the Revolution. You're going to see the tents and you're going to see the barricades. So it starts at 9 in the morning and it goes all the way up until 3 in the afternoon.
And the services are absolutely free?
The services, everything are free. We're going to have blood pressure testing, blood sugar testing. We're going to have the vaccination team that's going to be on board. We have our dental services. We're going to have general consultations, and if referrals are needed, that those will be rolled out. We have our VIA testing that will also be on board, and we have different other non-governmental organizations like Massey and Nancy McCall that will also be on board with us, as well as GRPA. So please come on down and look forward to coming to access our services.
Definitely. Dr. Greaves, do you have any final words for our listening and viewing audience?
Yes, I do. Health is wealth, and in order for us to be able to live healthy and long lives, we need to start to prioritize our health, and not something that we do because we found out the blood pressure is high today, or we found out that we may have cancer today, but something that we need to prioritize now. When we know that we may not have any sickness or illness, we do it now, because prevention is always better than a cure. So please come out to the health fair on Friday and access our services, and let today be the day that you say, I'm going to prioritize my health. I'm going to do the necessaries. I'm going to get my routine screening, and I'm going to be able to spread that knowledge to somebody else, and also share the information and to stay informed.
Thank you so much, Dr. Greaves, for joining me in the program today, and I encourage you and your department to keep up the good work that you guys have been doing.
And thank you for having me.
Thanks for joining us on the program today. I'm Host-Alicia Martin saying goodbye for now.